All right, today we're going to be talking about what is spinal stenosis. I'm going to try and simplify it for you as much as possible. And basically what spinal stenosis is narrowing of one of two canals in and around the spinal cord. So you have the central canal where the spinal cord runs through, and then you have the intervertebral foramen. So that is the little holes that the nerve roots that come out and exit the spine run out of and feed your arms, legs, feet and hands with sensation and motor strength. So there can be several causes of stenosis, and you can have all these factors, multiple causes of stenosis at once that can significantly worsen the stenosis. So one of the causes is a bulging or herniated disc. That would look similar to what this represents here. And as this disc in the spine herniates or bulges, the majority of them go backwards towards the spinal cord or towards the exiting nerve roots. So that would be one factor that would narrow either the central canal or the foramen in the vertebrae. Another cause, which you see pretty frequently with age, is called Fassett Arthrosis. Now these are the facet joints. These joints right here between the vertebrae above and the vertebrae below, if you can see. Now what happens over time? These joints wear and tear on each other when you bend or doing work, just with all of your activities of daily living. And your body begins to lay down new bone in an attempt to stabilize this region from the repetitive wear and tear or an injury like a car accident or fall. That new bone then begins to push backwards towards the spinal canal or the exiting nerve roots, or both, leading to spinal stenosis. Another very common cause of spinal stenosis is a thickening of the ligaments in the spine. So you do have, which aren't shown here on this model, but you do have ligaments running up the back of the spine and towards the most posterior part as well. Most commonly your ligamentum flavum. Now this ligament can hypertrophy or get too big. If you're somebody that uses their back a lot or somebody that's overweight, it's working too hard and it can build up and cause stenosis. As it builds up, it gets too big and too fat, pushes back towards the spinal cord. It can even press towards the exiting nerve roots, causing spinal stenosis. Now, what is the best test to see spinal stenosis? That's going to be an MRI of your spine. You can visualize the spinal cord, the soft tissue, the discs. X-rays are typically not the best diagnostic imaging to diagnose and see spinal stenosis. How does chiropractic care work for spinal stenosis? Well, chiropractic care can improve the flexibility and mobility of the vertebrae in the spine. So if you have stiffness and arthritis and a decrease in space where the central canal is and where the exiting nerve roots are, if we can improve the flexibility, improve the mobility through mobilizing those joints, you can free up some space in your spine to restore the mobility and decrease some of the symptoms with spinal stenosis. Also, physical therapy exercises targeted at addressing the biomechanical function of your back, whether through flexion or extension exercises, can also effectively treat and manage spinal stenosis. Also, we do use a variety of physical therapies. If there's swelling or pain that's being caused by spinal stenosis, we can bring that down with the physical therapies we use here in the office. Also, diagnosing this properly is very important. Oftentimes an MRI is required. We'll order that here in the office. and in some cases, the patient will need to be referred out for injections or possibly a surgical consultation if the stenosis is very significant. There are a couple other causes. It's a very small percentage of the population has too much back fat, and that back fat can press in towards the spinal cord and nerves, causing spinal stenosis and narrowing of these canals. Also, you can have a small fracture in your back called a spondylolisthesis, where the vertebrae is injured in a trauma and causes the vertebrae above or below to slip forward or backwards. That can also narrow the canal. So if you have any other questions, please contact our office or visit us online. It's Dr. Jeffrey Gerdes, your Raleigh, North Carolina chiropractor. Thanks for watching.